Hello, welcome to the Seco Direct podcast. My name is Dr. Tiwa, and in every human being, there's an organ called the parathyroid organ, the parathyroid gland, and it produces a hormone called the parathyroid hormone. And what does this hormone do? It helps in regulating calcium. And you know what calcium does for the body? It helps with making your bones stronger and healthier. While today we're going to talk about what hyperparathyroidism is, what the causes are, what the symptoms are, what complications that you could find out, what is the treatment, and other things that you need to know in terms of handling this situation. Let's get started and welcome to the episode. So when it comes to hyperparathyroidism, what do we need to know? We need to first know and understand what the parathyroid gland does. Now, the parathyroid gland, what it does is regulate the calcium and how it is produced and how it is regulated in the body. How does it do that? It produces a hormone called the parathyroid hormone. And that parathyroid hormone helps in regulating calcium in the body. In what way? It helps in how the bone absorbs calcium. It helps in how the kidneys also use calcium. So this regulation of calcium in the body is very, very important because we all know that calcium has some vital functions for the body, including helping with your bone health, helping with how the muscles contract. It also helps with nerve function. So when we are talking about hyperparathyroidism, this means that the parathyroid glands have become overactive. And what does that mean? It means that they've started increasing their production of parathyroid hormone, in turn leading to calcium disbalance and affecting those functions that you typically have. That is your muscle contraction, how strong your bones are. So what does hyperparathyroidism break down into? It breaks down in terms of causes into two: primary hyperparathyroidism and secondary hyperparathyroidism. Primary hyperparathyroidism, it means that there can be or there is a tumor in that gland, in the parathyroid gland. It's usually called an adenoma. So when there's a tumor on the gland, it usually leads to that gland becoming overactive. There's also hyperplasia, where there's just an increased level of production by the gland. Lastly, and more rarely, there is also malignancy. That is cancer. Cancer can also lead to the increase or the overactivity of the parathyroid gland. What of secondary? Now, secondary hyperparathyroidism is due to it overcompensating due to decreased calcium in the blood, because we as ourselves do not create calcium on our own. Our sources of calcium are usually through what we eat. Either we drink the drinking of milk, or eating of calcium-rich meals, or eating of bone marrows in chicken, for instance. Now, when we do not have good sources of calcium in the body and the calcium level is low, the gland takes that as a signal to try and correct that balance. And by correcting that balance, it produces the hormone on a higher level, leading to overactivity of the gland. Another issue is that of it compensating is if there's a kidney issue, chronic kidney disease, or if there's something like a severe vitamin D deficiency. In these cases, because the kidney helps in absorbing calcium, if there is any defect in the kidney, the parathyroid gland seeks to try and overcompensate for that issue. Now, what are the symptoms of hyperparathyroidism? Because it is related with calcium, they are very subtle and can develop over a long period of time. And they also vary between person to person. For instance, we have things like weight loss, decreased appetite, rapid or irregular heartbeat, nervousness, irritability, insomnia, muscle fatigue, shaky hands, sweating, frequent bowel movement. Also, it could also come together with having an enlarged thyroid gland. Also, we have some things like osteoporosis. Osteoporosis means weakness of the bones. I know it feels counterintuitive, or like, oh, it is what an opposite for an organ that causes bone strength, that increase in that organ's activity to cause bone weakness. Yes, it can cause bone weakness and can lead to bone fracture. It is also important to note that everyone with hyperparathyroidism may not experience these symptoms. Some people do, some others don't. So when it comes to hyperparathyroidism, what groups of people should be watching out for this? It commonly affects women above 60 years old, or mostly people that have a family history of this condition. In terms of diagnosing hyperparathyroidism, when you go to your healthcare provider, they would give you a test called a parathyroid hormone test, or they will also check your calcium levels in your blood. They might also ask for tests that would check for the subsidiary organ beside your parathyroid hormone. That is checking for what your thyroid, which is beside the parathyroid organ, what it is also producing, if they are also increased. And that includes your T3, your T4, your TSH, thyroid stimulating hormone. T3 and T4 are known as triiodothyronine or tetraiodothyronine, which are substances that are produced by the thyroid organ. Another thing that the hospital might provide is for you to do a bone density scan to check the strength of your bone or to assess bone loss. They can also ask for you to do a 24-hour urine test just to see if you are excreting out calcium. Another test that could also be brought about is an ultrasound scan, and that is just to check how your organs look in terms of how they look. Are they increased in size or are they not increased in size? Now, the thing is, treatment of hyperparathyroidism is important, but if you leave it untreated, it becomes a serious condition. It's not something that you cannot overcome. And when becomes a serious condition, it can lead to chronically high levels of calcium in the blood. And that immediately leads to gastrointestinal problems, osteoporosis, kidney stones, cardiovascular issues like hypercalcemia. For instance, hypercalcemia helps in the contractility of the heart. It helps the heart push blood more through the body. And when that happens, if you have hypercalcemia, it means that you could lead to hypertension, for instance, or other heart problems, irregular heartbeat, another instance that could also come about. You also could have menstrual cycle and fertility issues if you just leave it untreated. Given these potential complications, though, treatment of hyperparathyroidism is very, very crucial. In terms of treatment of hyperparathyroidism, we have the primary hyperparathyroidism and the secondary hyperparathyroidism. Now, the primary hyperparathyroidism, now, which it deals with probably an adenoma of the gland itself, you'd have to do what is called a surgery, a parathyroidectomy, to remove it so as to bring down the production of the parathyroid hormone. Now, in terms of patients who cannot undergo surgery, medications can be given. Medications like calcimetrics, which mimic calcium in the blood and reduce production of parathyroid hormone. Then we also have biphosphonates, which are medications that help prevent bone loss. Hormone replacement therapy also could be done, especially for postmenopausal women, to help against getting osteoporosis. Additionally, if it is secondary hyperparathyroidism, you can just correct what could cause it. For instance, if it's vitamin D deficiency or if it's a kidney function, you treat that. Once you treat that, the parathyroid gland responds. In conclusion, hyperparathyroidism is a condition that can be easily managed with proper monitoring and making sure you take the drugs, and in some instances undergo surgery. It is very crucial for you to get ahead of this so that you do not suffer complications. And if you suspect that you have these symptoms, please reach out to your healthcare provider so they can get ahead of it and they can lead you on the direct path to conquering this condition. Remember to always stay informed about your health, because that's the best thing that we want to offer you here at Seco Direct. If you have any questions, any comments, please leave them in the comment section below. Until next time, I remain your host, Dr. Tiwa. I'll see you on the next episode.